Good evening, everyone. Today's session is going to be really helpful and it's led by Dr. Upali Bhatia. She's going to talk about common early pregnancy complications you need to know. So stick around until the end and ask us questions if you have any. Let's not keep you waiting any longer. Dr. Rima, you have got the stage.
Hello everyone, I'm Dr. Rupali Bhatia. I'm an obstetrics and gynecology consultant here in Apollo Cradle, Nagar. So I'll be talking about the early complications that can occur during pregnancy. The very first and the most common complication that can occur is the problem of nausea and vomiting in early pregnancy. It's very common to have vomitings during your early course of the pregnancy. These can be absolutely okay if the vomiting frequency is just once or twice in a day. However, some females experience a lot of it during the early months. For example, some may vomit for about 8 to 10 times in a day, may feel a lot of weakness, and even get fainting episodes. That is when you should consult your doctor. Of course, these vomitings cannot be curbed absolutely, but the frequency can be reduced with the help of little medications and the pattern of your eating habits. What is the problem that can occur because of excessive vomiting? That's a very common question that patients ask. Yes, it can cause a lot of problems to the baby because since you're vomiting, there is not enough nutrition that is going on to your baby. You will be dehydrated. That may again lead to the fainting episodes and further on reduce blood supply to the growing baby. This can hamper the growth of the inside, the growth of the growing fetus, as well as can result in very rarely it results in. However, if it gets too prolonged, it may result in even miscarriages. Second, the most common complication that can occur during early pregnancy is what I just said, the miscarriage problem. How do abortions or miscarriages happen in early pregnancy? There are various reasons, but what you can do from your side to prevent those complications? First of all, try to prevent all kind of falls during your early pregnancy. Try to be very careful while walking on the road or while using staircase. Secondly, please restrict to the diet that is given to you by the consultant or your doctor. Many food supplements that you take may have certain substances that may act as a abortifacient and result in miscarriages. So please stick to the diet carefully. And thirdly, take all the precautions that are told to you. For example, avoid sexual intercourse during early months. That may also lead to disturbance down there that can cause miscarriages. Coming on to the next complication, there are certain diseases that can also occur in early pregnancy. Commonly, infections which can occur during early pregnancy include rubella or varicella. Now, rubella is commonly called as German measles. What is German measles? It's an infection that can result, one, in miscarriage of the fetus. Secondly, it may also result in genetic disturbances in the fetus, which will cause deformities when the baby is born. Similarly, varicella or chickenpox, you must have heard of the chickenpox. It is not as dangerous for you as it is for the growing baby. Similarly, it can cause deformities in the growing fetus. So, you need to basically beforehand consult a doctor before you want to become pregnant and get vaccinated against those infections. If you are not vaccinated, there's a high chance that you may develop these infections during initial months. Once you are infected with these, there's basically no treatment to prevent these infections from affecting the baby. So try to get vaccinated and therefore consult a doctor before you want to conceive. The another complication that can occur in early pregnancy are basically the, it's not a complication, but it's like the pregnancy is not normal and it's an ectopic pregnancy. It's a problem in implantation. So what happens instead of the fetus growing? Okay, I'll come on to that question also, the acidity part. Let me first talk about the ectopic pregnancy. In ectopic pregnancy, the growing fetus grows not inside the uterus but outside the uterus. Now, why is it harmful or why is it not what we want? Because the growing fetus is not getting any blood supply outside the uterine cavity. It doesn't get enough nutrition, therefore, it can't grow outside the uterus and may result in miscarriage as well as rupture of the organ with which it is growing. For example, if it is growing in the fallopian tube, It will result in rupture of the tube if there is enough of the time for it to grow. It may also result in rupture of the tube within very initial few weeks also. Therefore, here comes the importance of the very first ultrasound that we advise you to undertake at around 6th or 7th week of pregnancy, that tells us about the location of the fetus where it is implanted. That way, we can prevent or we can give you timely treatment to avoid any complication of the ectopic gestation. The next question somebody asked about was the acidity problem that usually occurs in early pregnancy. It is quite related to the nausea and vomiting. So, how can this acidity be stopped or reduced? Now, pregnancy itself is a hyperacidic state. You're bound to have acidity during the initial months of your pregnancy. The best way to avoid acidity is to correct your feeding habits. Now, in early months, you can't have meals like another adults 3 times in a day. You should break your meals in 6 parts and eat small meals at frequent intervals. For example, if you've taken something at 9 a.m. in the morning, try to take some snack or some juice at around 11:30. Then again in 2 to 3 hours, take any other supplement. It could be a liquid like naral pani, it could be some fruit. In another 2 to 3 hours, you can take something solid to eat like roti or rice. Similar way, eat small portions and eat them frequently. That's the best way to avoid acidity. Second, the most important thing is to have a little physical activity during initial months of pregnancy. That's very important. Walking will help to reduce the acidity of pregnancy. It will help in proper digestion of the food, and it will also help you remain active throughout your pregnancy. So that's very important to prevent acidity. Thirdly, please do not go fasting for many hours. So there's a misconception, if we eat too much, there'll be acidity. On the other hand, if you will eat very less or you will have a lot of um, fasting hours in between the two meals, that will also result in acidity. So try not to have a gap of more than 4 to 5 hours between two meals. If you do not feel like eating a lot, please take some form of liquid. Again, it could be lemon juice, it could be naral pani, it could be some form of another fruit juice, it could be even lassi or chaach in common terms, what we call as, or any yogurt based drink also. And lastly, very important, you can consult your doctor for some medications that will help to prevent acidity during early months. Now, if that is clear to whosoever has asked this, the next complication that we come here is about the diabetes. Diabetes is very common these days during pregnancy. It can come in early trimester also, it can come in middle trimester, it can even come at the last month of pregnancy. So again, what you can do from your end to prevent it is one, please take care of your weight gain during the pregnancy. That's important. Unlike the earlier notion that you can gain any amount of weight during your pregnancy and it's healthy for the baby, it's absolutely wrong. Your weight do not doesn't basically determines the growth or the weight gain of the baby directly. So the amount of nutrients you are taking, the basic balanced diet that you are consuming will again affect the growth of the baby, but how much calories that you are intaking will not affect the weight gain of the baby. So try to take restricted calories, do not gorge on a lot of sweets, maintain your weight throughout the pregnancy, pay frequent visits to your doctor so that weight gain can be monitored, and take a balanced meal instead of taking a lot of sugars. Once in a while is okay, but do not indulge in a lot of sweets and especially packaged meals. Please avoid packaged meals altogether. Be it soups that comes in packeted form, freeze dried forms of things, snacking. Snacks usually contain a lot of salt and high amount of oil, refined oil. So that's not good to have in pregnancy for anybody rather, if even not pregnancy, that's not a good thing to have. So please avoid those kind of snacks. If you want to have something in between your meals, you can take on fruits, you can have curds, you can have raitas, but please avoid any kind of packeted meals during that period. Another common complication that we face during early pregnancy, that could be because of bleeding. Now, there are a lot of chances where we have unwanted bleeding during initial months of pregnancy. At 5 weeks of pregnancy, there can be a little spotting, which is also known as implantation bleeding. Please do not confuse it with the Please do not confuse it with the abortion thing, because this is absolutely okay when the placenta is getting implanted in the uterus. There may be a little spotting. However, if the bleeding is more than spotting, then immediately please consult a doctor. Bleeding is not basically indicating an abortion necessarily. Like I said, one, it could be implantation bleed. Secondly, it could be a bleed that could further on increase and result in miscarriage. Therefore, consult a doctor where we can give you appropriate treatment and prevent further mishappenings. That could be curbed and restricted at that point only. Next complication that we come on to is the complication of high blood pressure, or what we call as gestational hypertension. It is basically development of high blood pressure in pregnancy. Okay. Um, so there's one question about the travel during pregnancy that I'll address later on. Initially, I was telling you about the blood pressure in pregnancy. So initially, what happens? Usually, there's a tendency of having a low blood pressure during early pregnancy. That's a very common thing when patients ask, "My BP is 90/50. Is it okay or not?" Yes, this is absolutely okay. During early pregnancy, the BP tends to fall. So it is in the ranges of 90 to 100 for the upper systolic, and diastolic or the lower blood pressure is in the range of 50s or 60s. That's absolutely okay to have. What is high BP in pregnancy is when your BP shoots up more than 140/100. Again, to avoid such kind of a problem, I would advise you to cut down on a lot of snacking, like I said, because it is very much high in salt content. That is not good for you. Avoid using table salt on a lot of things. The salt that you put in your regular meals is absolutely okay to consume. And second most important thing here also, please have a lot of physical activity. The best one is walking in pregnancy, because it will not give you any kind of risk factors involved with it. Another form of physical activity is like yoga, dancing, that requires the presence of a practitioner with you, a trained practitioner. However, walking doesn't require anybody alongside you. So walking is the best thing that you can carry on your own during pregnancy to avoid such complications. Now, here's one question about the traveling part. It's a frequent question: can we travel during pregnancy or not? Yes, you can absolutely travel during pregnancy, but here are certain precautions that you need to take while you are traveling. First of all, please do not travel long distances. Long distances, I mean, do not take a train ride or a plane or even a bus ride for more than 4 to 5 hours during initial pregnancy, because during your travel period you are bound to one place. There's not much space to move around, and in initial pregnancy we want you to move around, we want you to walk a little. Restricting at one place will result in pooling of all the blood and the fluids in your lower extremities. That will result in swelling of your lower limbs and will give you further complications. So you can have short travels of about 2 to 3 hours. Certain other precautions that you should take during your travel period is that you should consume a lot of liquids, because during travel period we tend to go dehydrated. Make it a point to have fluids on regular basis while you travel. This will ensure a good blood flow inside your body and a good blood flow to the baby as well. Another precaution while traveling, please avoid bumpy roads and bumpy travels where there are a lot of basically potholes or guttas on the road. That will give a lot of pressure to the lower parts of your body, specifically vagina, which may result in bleeding further on. So these are the certain precautions that you should take while traveling. If at all you have to travel for long hours, say 10 hours or 12 hours, I would advise please break your travel into parts. Do not travel in one go for 10 to 12 hours. You can do like 2 to 3 hours, then 3 to 4 hours, then break, and then again 4 hours. And please do carry all your medications prescribed by the doctor while you are traveling. I hope everything is cleared about the complications part that we can have during early pregnancy. Okay, the next one is about the mood changes. Okay, the mood changes are also very common to have during early pregnancy. Basically, the hormonal interplay in your body is different at this point of time. So you're bound to feel a little low, a little depressed. Further on, the vomiting and the nausea of pregnancy adds on to it. So I would say try to change your focus. if you are always concentrating on the vomitings, the taste changes, then you'll burn to get a little low. Please change your focus to other constructive activities. For example, you can go out walking, you can talk to somebody close to you, you can please, the best part is to go out walking in the park because that helps you to elevate your mood by looking at the surroundings, by changing your environment. This will also help you to prevent a little nausea and vomiting of the frequency, because this vomiting has a psychiatric element also. When you are homebound, when you're not doing anything, you're just sitting in front of the TV, you're bound to feel more nauseating. However, if you are working at your office or you're working in the park or you're out somewhere, usually that vomiting is curbed somewhere. So I would say to prevent those mood changes, please involve yourself in a constructive activity. It could be cooking for someone, it could be painting, it could be listening to good music, it could be any activity, or else please move out of the house and please have a walk in the surrounding areas, especially the green areas. So I hope all the things are clear. Any further on any questions anybody asks wants to ask, please you can feel free to ask. Okay. Okay, so I'll be telling you further on about the supplementation that you should take during early pregnancy. So, one very important complication is related to it. This is having genetic deformities in your fetus. So, nowadays we listen about a lot of deformed babies. For example, Down syndrome. There are a lot of other diseases like these that may happen to the child. So, for that, to prevent that, please take folic acid supplementation during your early pregnancy. It's very important. Although all the diseases cannot be prevented by mere intake of the folic acid, however, it will help you to prevent spinal deformities in the child. Folic acid supplement is given in form of a tablet to you by your practitioner. It is absolutely necessary to consume that thing during first 12 weeks of the pregnancy. Any folic acid supplementation, it comes in various formulations in the market. It's kind of a vitamin B that you are taking. Why are we giving you this here during your pregnancy and why not other vitamins? Because this is the vitamin that gets destroyed when you cook your food. Therefore, it is important to give you from the outside sources. However, there is no need to consume other vitamin supplements as well during your pregnancy. I've seen a lot of people taking vitamin B, vitamin C, vitamin D. It's not necessary unless and until advised by your doctor. What is the most important thing to have during early pregnancy is a folic acid tablet. So please make sure that you're following those instructions well. Another important thing that you can do in your early months of pregnancy is to have timely antenatal checkups. Please go and visit your doctor frequently during that period because that is the very crucial period where placenta is not completely embedded inside the uterine cavity. So this is the period where there is a maximum chance of getting a lot of mishaps. So take care of yourself, pay frequent visits to your doctor, follow the instructions properly, eat well, and please also consume your supplements on time. Anything else anybody wants to ask? All right, so I think that is about it. This was all about the early months of pregnancy in nutshell. Lastly, I would like to say please enjoy this period. I know it's difficult to say, but do. Okay, one question we had about too much urination. All right, this is again a common symptom of early pregnancy to have a lot of frequency of micturition during early months, which means that you really need to pee a lot during your earlier months. You might feel good, you have to go to the washroom every 2 or 3 hours. That is okay. It is absolutely okay during this period. However, if it is associated with any kind of itching, any kind of irritation, or even pain in your lower tummy, then please consult a doctor. It could be a urine infection. Mostly, it's commonly okay to have this symptom during early months of pregnancy. However, like I said, if it's associated with any of these signs, you may need a urine test. If that reveals an infection, there are medicines to help you out with this. So that's all. Okay, one more question. Raw papaya can cause miscarriage. All right. So, see, many of you must be knowing this, that we always tell you to prevent eating papaya in your pregnancy, not just raw, even the other one, ripe papaya also. The reason being, the seeds of the papaya contain a chemical that acts as an abortifacient and may induce abortifacient changes in your pregnancy. Also, papaya may cause in some people diarrhea or loose stools, what we call. Having diarrhea during early months of pregnancy is related with cramps of the intestine, which may further on lead to cramps in the uterine cavity. If there are any kind of cramps in your uterus, it may lead to a miscarriage or an abortion. Therefore, please be careful in eating papaya during pregnancy. It's not like if you have eaten it once by mistake and it will lead to many complications. It's not like that. But in general, we say do not consume it on regular basis. If once you have consumed it by not knowing anything about it, that's absolutely okay. It will not do any harm. Okay. So if that's about the questions. Again, I would like to say thank you. Please enjoy this period. Try to have lesser and lesser complications by following all the instructions, and behave as if that you are pregnant only and not having some sort of a disease. And please continue your physical activity. Like I said, it is very, very important. Unless and until told to you by your practitioner to go on rest or restricted activity, please continue working during pregnancy throughout. Thank you.